All righty, everybody. Welcome to the Pulse of Healthcare. I'm here again today, Dr. John McCormick with Peter, and we're going to talk about something that is pretty difficult this time of year. We talk about healthcare most of the year, but we've just recently finished the Mental Health Month, and we're coming into the holidays, and mental health really becomes a focal point for a lot of people over the holidays because of the nature of it. I mean, normally when we think about Thanksgiving and Christmas, everybody's all fired up and it's awesome and it's about the kids and it's about family, except when it's not, right? And so if you're one of those people that suffers from trauma, doesn't have a family, maybe you're recently divorced, I mean, all the things that go into that, the holidays can actually be pretty depressing because it actually emphasizes your, social isolation, if you will. So I'm actually going to let Peter kind of lead the discussion a little bit today. I normally do most of the yapping, but I'm turning it over to Peter.
The, the holidays are extremely stressful. In fact, research has shown that 9 out of 10 people feel additional stresses during the holidays. It's everything from financial and trying to buy gifts to where are the relatives going to sit at the holiday table. It just 9 out of 10 people are going through a more difficult time than they do the rest of the year. And one of the things I wanted to make sure that people understood is we have mental health resources for them to easily take advantage of, like the telehealth, telemental health. And that's been an addition that you put on in the last year. Have you seen how that is being used? Can you kind of?
Yeah, I mean, absolutely. So let me address two things there. I read an article last week where a couple of the major carriers are getting in trouble every week. Where we read some new article where they're in trouble, and this one's about shadow or ghost networks where they've added a lot of mental health providers. But when you actually start to engage in those plans, through those plans, and try to access that mental health, you discover that they really don't actually have those mental health providers, or if they do, they don't have any openings. So if you're suffering from a crisis, like I need to talk to somebody now, and you're trying to go through your major medical carrier and the people they have listed to provide that care, you can't get an appointment with for 6 months, they're not providing you good service, right? The whole point of years ago when they passed a law, the Mental Health Parity Act, where you should have mental health parity with your primary care.
Yes.
You should get those at the same level, which means if you could get, and that varies from state to state, unfortunately, but if you're here in where we are in the state of Texas and you can generally get a primary care appointment within a week, you should also be able to get a mental health appointment within a same or a reasonable amount of time, right? The nice thing about the mental health that we have that's available, and we have it through a couple of different sources, but directly through our telemedicine provider, is you can normally get that within 2 to 3 days. You can get emergent help immediately, but you can get telehealth visits within just a few days.
The I as many people know, have had experience with the mental health and depression, PTSD, and trying to deal with those. Getting an appointment 6 months from now does absolutely nothing. As you start, there's a relief of stress of I'm doing something about it. But if you get put off, all the stresses come back, which is why I'm such a strong advocate for the telemental health. You can just walk into a different room, make the phone call, and get some advice and some coping skills. So I think those were great additions to the product line that you added.
I think so too, and I want to stress a couple of different things. When Peter and I are talking, it sounds like one seamless process, but what we actually have is a layered process when it comes to mental health. So through our telemedicine, one of our telemedicine providers, if we add that to your plan, when you call in, you're talking to a MD medical doctor who's trained in mental health crisis intervention. So that's one of our products, right?
Right.
We have another one through Teledoc, happy to say, all right, which provides not only your core medical, but also mental health, nutrition counseling, which sometimes is very much related to mental health. People don't realize nutrition and mental health go hand in hand. All right, so that's another product that we have. All right, and then we have a follow-on product with our kind of what I call my third telemedicine mental health product. And that's actually for somebody that we go, okay, this is somebody that needs more than a conversation. This is somebody that needs more than that, once every few months kind of check in, mental wellness check. We actually do have a company we work with that does telemedicine nationally that actually will put you on what I call a curative track. All right. So when you go and you onboard with them, this is one of those, if you're one of our members and you need real help dealing with PTSD, dealing with addiction, dealing with any of those things, this group is not in the business of counseling from now until the end of time. They're in the business of getting you the help you need, identifying what you need to do, and literally putting you on a 12 to 15 month curative path so you actually get the tools you need, and can exit, with all the tools you need to deal with crises in your life. And I think those tiered approaches like that are so important.
I believe that one company you're talking about also has metrics to help move you along, so you understand what the goals are as you're moving along.
They really do, and if you actually look at their analytics, they've got like a 90% cure rate, which is almost unheard of in this marketplace. And the nice thing about them is you might be 2 or 3 or 4 sessions in with them, and they see that you're not progressing along the path. They'll actually stop, do a reassessment, and go, you know what? We really thought we were dealing with this, but in these last 4 sessions, we've determined we're dealing with actually this over here. And so they will actually modify and amend your treatment protocol to target what you need, as opposed to, so they're one of those groups that are going to evolve with you if that's what you need.
This is the time of year when family is together. You see people under stress. You also see them kind of withdraw. It's really just a matter of asking a couple of questions about how are you doing, and listening to the answer. Now you've got an answer that you can help refer them to, that is easy for them to do. It's non-intrusive. It doesn't wait 6 months to make an appointment. So I would anticipate that we're going to see an increase in those types of phone calls in the December, January time period.
We often do. I mean, it actually starts, I hate to say it, it kind of starts next week. That run up to Thanksgiving, a lot of that anxiety, and some of it is just people want to be reassured. It's going to be okay. All right. And we do that hopefully as human beings around each other. And you said something really important. You said, listen to the answer. So many people say, hey, how you doing? And okay. Well, if you're not the person that says okay all the time, right? You're saying, man, I'm amazing. I'm da-da-da-da-da. And today, if I ask you and you say, I'm okay, I should be prompted there to say, are you really okay? What's going on, right? And then having the courtesy to listen to the answer. So, when we engage in those kind of things, oftentimes in a business relationship like this, we've got 10,000 things on our plates, right?
Yep.
And we say things that are nice platitudes like, hey, good morning, and da-da-da, but we're really not waiting for a real response. We're waiting for the platitude response, all right? And what we should do is make sure we're pausing, listening to that response, and then making sure we're reacting in a very human, connected way and saying, oh, I actually did hear you. I do realize you're probably not really okay. And, and then being honest. Do I have time to sit and talk to you right now? Or when can I come back and so we can really have a real sit down conversation, or do we need to go to the next step? Do we need to actually reach out to one of our experts out there in the field and say, hey, you know what? Your problem's a little bit beyond what I can do for you as a friend or a mentor. You know, you need to talk to somebody that's got some real expertise in the field.
That is tremendous advice. And we're all guilty of doing that at some point. Once you go through an experience, then you start to listen.
And it's tough. You know, you don't realize how hard that is. You know, I tell a story about we added mental health telemedicine several years ago now to our plan. And I was working, doing an onboarding for one of our groups that had been with us for a long time. And mainly a bunch of men that were, you know, mechanics and, you know, just kind of the rough and tumble, quiet, silent type. And I'm in there talking to the boss, and this big dude comes in. He's probably about 6'3", you know, 200 something pounds, you know. And I'm like, and he's like almost crying, and I'm like, what's going on? You know, like, okay. And he's like, are you, you know, Dr. John? I'm like, yeah. You're with our health care? And I said, yes, sir, I am. And he goes, I just want to thank you for adding that to our plan. And I was like, adding what? And he goes, the mental health thing. I got it for me, and of course, my family and my daughter. And it turns out his daughter was away in college and going through a crisis. And, you know, this is one of those where he's the big, strong dad, and he doesn't have that real good communicative, you know, connection with his daughter. She just didn't real feel comfortable picking up the phone and saying, "Hey, Dad, I'm feeling, you know, emotionally weak." I mean, I know that's hard to do. Even it's harder sometimes, I think, for guys than girls. But yep. You know, I have a strong daughter, and she's much easier talking to mom than me, right?
Right.
But he's like, yeah, she was going through a crisis. She was able to, you know, pick up the phone, talk to a provider, got the help she needed. Then afterwards, she was able to communicate that back with her dad. And he says, you know, I think her ability to do that, you know, probably saved her life in that moment. And I'm like, those are just kind of the stories you don't hear.
Yeah, and those happen every day.
Every day. I mean, a lot of people know, as a lot of y'all know, I am a veteran, you know, and we have a very high veteran suicide rate every day in this country. And I hate to tell you, we're conditioned not to cry for help and things like that. I think in the last maybe couple of decades, we've gotten better at it, you know, as people are coming back from traumatic situations and war zones, being able to guide them to the care. But when I say better at it, I don't mean great. I mean better. I mean, I wish we did this 100% of the time for 100% everybody, and we don't. And a lot of times the veteran will end up suffering in silence because that's what they've kind of been conditioned to do.
Yep.
Until they get so bad that they're beyond help, you know, and then unfortunately they do the unthinkable.
Well, I certainly hope everybody, when they have a crisis, takes 10 seconds to call the hotline or to call us and get that mental health by just walking into a different room and using their phone.
Yeah, absolutely. So we're going to wrap up today saying we know it's the holidays. We hope you have a great Thanksgiving and Christmas and Hanukkah and all of those things that wrap around that, and you have the opportunity to be with friends and family. But if you are stressed and you need help, please, please, please reach out to us at Ovation Health. Let us help you get the care that you need. If you already have one of our telemedicine partners as part of your plan, do not hesitate to use them as a resource. All right. Thank you very much. All right. We'll see you in a couple of weeks on the Pulse of Healthcare.